All right. Well, thank you for the presentation. Well, so Catherine's presentation was about this whole SDI framework in the international context. Well, my presentation will rather focus on a specific example of the use of geospatial information in South Korea to successfully manage COVID-19 crisis. So it will basically talk about how a robust Nsdi enabled the development of COVID-19 related apps, um, um, which eventually increased community resilience with its use. So my presentation will cover mainly four parts. First, the COVID-19 outbreak in South Korea, then community need-based apps and its impacts, and what are the major success factors behind the rapid development of COVID-19 apps. And finally, I will give you two examples of how the community or individual used geospatial information to develop COVID-19 related apps. So let me first introduce you the COVID-19 outbreak in South Korea. The first case was recorded in January 19th. And then we had this continual mass infection and then small other collective infection caused by internal movements and other external influx. So South Korea has been lauded for a successful management of COVID-19 crisis. As you can see on the screen, New York Times has published recently this article on how South Korea flattened the curve, and the lessons that the third lesson that they were saying is that we have this contact tracing technology and all of this ICT technologies and infrastructure that have contributed in successfully managing COVID-19 crisis in South Korea. So, I would like to talk more about this, the characteristic of this COVID-19 virus. Because it is contact-based transmissible, we had to control the location. So different organizations, including public sectors, such as local government, the private community, and also with public-private partnerships, they have developed several location-based apps and launched it quickly so that the community won't be further infected by the virus. So first, we have this emergency broadcasting service that the local government, this is a service uh, in which local government sends messages to people living in the nearby vicinity of new confirmed case. And then the community started to develop different apps, such as Corona Map, which shows the pathway of the confirmed case patients. And then other communities started to develop other apps, such as Corona Now, Now and Here app, Quebec Plus app, Mask Stocks app. And then the government came up with the self-quarantine app in March 2020. So we have more than 50 different apps related to COVID-19 by February 2020, and more than 150 mask stock apps by April 2020. So we have hundreds of different apps, but how would that be possible? So I'd like to give you the reason behind such a rapid development of COVID-19 apps. So first of all, as I've introduced you, the emergency broadcast system was launched by the government, but then we have different community developed apps, but I will give you just a few examples of how did the community use different different geospatial information data released by the government, and how the policy and framework included in the Nsdi contributed in developing those community driven apps. So this is some of the impacts of the different apps. So because we had this Corona map, which shows the pathway of the confirmed cases, people could go outside and they could do their daily economic activities. So it eventually led to an increase of economic activity and also reduction in infection potentials. But also because we had this mask stock status app, people, the complaints from the civilians reduced drastically. For instance, the first day that we have launched this 5-day rotation mask, which is some people with some number of ID number, they could buy the mask, the public mask on Monday, and then some other people with social ID number ending with 3 and 7, they could buy the mask on Tuesday. So we had this 5-day rotation mask. So we had a bit of a complaint, but then after launching this mask stock app, we could see that the civil complaint was reduced drastically. So these are some of the community impact that we had from these different apps. And also I have this figure just to let you know that South Korea was the country with the highest ranking of monthly download, growth in monthly download apps, medical apps during COVID-19 pandemic. And then comes India, then worldwidely 65% increase of medical apps. So these are some of the figures that I wanted to share, that South Korean were very active in downloading different apps. So now I'd like to go to the success factors, mainly for the community-driven apps. So I'd like to talk about this policy, legal, and regulatory framework. How did this framework contribute in releasing the data, and then how the community could get access to this data, and how could they develop? So I'd like to talk about this, the policy and legal regulatory framework of NSDI. So South Korea launched its NSDI in 1995, and then gradually we had this first, second, third, and fourth iteration, and now we're under the sixth iteration, which is valid until 2022. So we have what is called a 5-year basic plan. So based on the legal acts, we established this NSDI 5-year basic plan, and in which different policies, regulations, and future directions for NSDI developments are included. So during the 5th iteration, we had this open data policy, which was launched in 2013. And then gradually now they're improving the data sharing systems and platforms. And we're going toward this NSDI, which is more community driven than central government driven. So these are some of the policy frameworks and NSDI regulations that contributed in the rapid development of COVID-19 apps. So it's majorly open data policy that contributed a lot, but there are other aspects of NSDI that acted as part of success factors. So because we have this open data policy, we have a central geospatial information data sharing portal, which is called the NSDI portal, in which you can get access to different geospatial information in a shapefile format. Then you have other services, map services, such as 3D, geospatial information data. You also have open API. You also have other knowledge platforms. When people upload some questions about some geospatial information, how to get access to some data, those are the knowledge platforms provided from the NSDI portal. We also have the real estate service portal and other search engines. So because we have this open data policy, we could launch this NSDI portal, and in which different community and individual could get access to the basic geospatial information. But I would also like to tell you about how South Korea managed COVID-19 crisis during mass infection, because the community could only develop different apps, use data to develop a certain pathway tracing service and launch the apps. But during this mass infection, we had to go through another um, analysis and internal infrastructure using process, so that we could control and have a visualization of this pathway tracing. So this is another aspect of NSDI, which is data analytics tool. But this is more going from community level to the government oriented development of COVID-19 related app. The reason why I'm introducing it is because during this mass infection, a lot of news and other articles were talking about this epidemiological investigation support system. But I just wanted to highlight that this was at the central government level, not at the community level. And I wanted to just briefly tell you about the success factor of how we could control this mass infection. So because South Korea has several smart city projects and master plan, we have this smart city center in different big cities, major cities, including Daegu, Incheon. And because we had this smart city data center, which could analyze different pathways using credit card data, transport data, and other mobile data, they could visualize the mass infection of 300, 400, 600 confirmed cases per day within 10 minutes. So, but we had this infectious disease control system. We had this infectious disease prevention and control act, which permitted the release of this personal data only for public purpose, to trace the patient's data using those private data. So these acts basically allow to get access to private data, but only for analysis, only for to trace those patients' different locations, and release those data to the community, so that they can avoid going to the infected area. So this is not a data that is in the hand of the citizen, but it's just the data that is controlled by the government, but is possible to analyze with the presence of smart city data center. So based on this prior acts and the presence of smart city data center, we could rapidly launch the epidemiological investigation support system within the smart city data center. And so this is how they get approval from different companies and from different association, and then get approval from the Ministry of Health and Welfare. So you can see in the below table that there is pre-implementation and post-implementation. So they could do the analysis within just 10 minutes. So this is the interface, the EISS system interface, an example of pathway tracing using those data. So now I'd like to go back to how the community used the released open data. So we have this different private platform and public platform, and people can get access to links data from those different platforms and database. And how the robust NSDI contributed in developing different apps, I'd like to give you just a brief example of Corona Map and Mask Stock app. So because we had this robust NSDI with open data policy adopted in 2013 as part of the 5th NSDI basic plan, fundamental data sets were released, and other private companies such as Naver and Daum developed, based on this fundamental data set, developed API data. And for the COVID-19 data, well, it's released from KCDC, but then the community used this list of different locations to geocode it from CSV file to get X and Y coordinate, and then integrate it with the linked API base map. So this is just a brief example of how people can get access to API maps. They get the coding from Naver or Daum, and then they drag it and put it in Visual Studio Code or other code editing platform. And they use this JavaScript to develop apps. And using these data sets released from the local government, they transfer from address data to XY coordinate data, and then they put it in the coding as X and Y coordinate. So that was the example of how they developed Corona Map. But for Mask Stock app, it's a little bit different because we have the Mask Stock app as an API format developed by the private company and public sector. They could just use API base map and also Mask Stock API map from Open Data Platform website. Yeah. So conclusion. So we have these different apps, we have these different systems, broadcasting services. But what's the most important thing is that after launching the emergency broadcasting services, the community could develop different services because we had this open data policy. We had the presence of different geospatial information, including the linked base API map. So I'd like to just conclude saying that because we had a robust NSDI and open data policy, we could rapidly develop different COVID-19 related apps and ultimately have a good impact at the community level. But there are some limitations with open data policy. It is that because there are some privacy issue, these different location data, the list of location data are released only for 14 days, and then they withdraw this data from the official website. And also the other thing is that when we have mass infection, the community cannot get access to this to COVID-19 related big data because they're facing privacy issues using credit cards, transportation cards, and other mobile use data. So these are some of the challenges that we have been facing to control COVID-19 in South Korea. And thank you to listen to my presentation. Yeah, that's the end of my presentation.
Thank you.